Our learning objectives for this final session are firstly, to explore issues related to trauma in the workplace, and secondly, to explore some ways to move our organisations from the top down to be consistently and wholly trauma-informed in 30 minutes. First of all, let's recap from this morning. Trauma-informed care recognises the impact of trauma on health. It recognises behaviours as maladaptive coping mechanisms. It recognises the need to avoid unintended trauma or re-traumatisation. And by this, we pay particular attention to reducing triggers from ourselves and reducing triggers in the environment. Trauma-informed care recognises the importance of delivering services that facilitate healing through genuine, authentic and compassionate relationships. So in order to provide consistent trauma-informed care, we need to support our staff. This begins with staff education. So programs like today's education session needs to include cultural competency, full orientation to understanding trauma, what trauma is and the effects of trauma. And this can be delivered in varying formats. We can do learning in the moment as we go from our colleagues and our leaders. We can have regular scheduled rounds or lunchtime meetings, and we can have formal retreats. Secondly, clinical supervision, it can be very helpful in the workplace. Now, I'm not sure in nursing currently these days how much clinical supervision is a part of the normal work environment. I know it's really best represented in social work and counselling areas, and I know it is very poorly done in medicine, if at all. Clinical supervision is basically a number of things rolled into a session with a supervisor who is very experienced and formally trained in supervising. So it's somebody that has a lot of experience in your area of work and who is there to support you on a number of levels. So some of these address standards of the work that you're doing and clinical audit process, case reviews, etc. It also serves to develop personal well-being of the worker, to help identify any issues that they may be having in their practice and to try and explore ways of helping with those issues. It also helps to develop specifically knowledge and clinical skills and helps a practitioner to reflect on their practice. It requires the setting of a healthy workplace culture, which we'll talk about in a moment. And evidence suggests that having regular clinical supervision is associated with improved patient outcomes and increased staff morale, retention, job satisfaction, and reduces absenteeism from work. My third bullet there is mentoring trauma-informed practice, and that's really learning by example in the workplace. Finally, at an organisational level, your work environment needs to have policies and activities to support staff self-care. So let's talk about that staff care. Many workers in the helping professions have personal trauma histories. ACE scores that we were talking about earlier in the day tend to be higher in nurses and counsellors. Not so sure about doctors, but possibly. So we're coming from a baseline of perhaps having a little more risks around managing ourselves at work and managing our own boundaries. Added to this, we have workplace stress. This is very emotionally intense work. I don't need to tell you this. We've been hearing it all day from Jason and Patty and from myself, that a day at work is emotionally draining. Most days at work for most people, I'm guessing. The workload can be very high, particularly I find for nurses, particularly I find for the nurses in a residential treatment setting where I work and in hospital settings as well. that they're required to look after a number of people. You're not looking after just one-on-one. Like in medicine, we often just have one patient that we have to deal with at a time. Nurses have got a handful of patients to look after, and they can be hit at any time of the day, multiple times at the same time, with requests for their needs for very emotional stuff a lot of the time. There can be funding issues and other stresses in the work environment as well. There can be staff injuries, so pain, chronic pain secondary to being injured and having to continue with your heavy workload just is another stress on top of everything else in your work day. Bullying may or may not be present, hopefully not so much these days, with more of an awareness of bullying in the workplace, but I'm sure it still exists. It's very hard to be continually at your best. Jason was talking about that this morning, particularly about having to always be on the ball, and that's what we expect and need people to do, but that's very taxing. So what happens if that gets the better of us? So I'd like to talk a little bit about vicarious trauma. Jason mentioned it this morning in regards to burnout, and there's kind of a group of syndromes that we see, burnout being one, vicarious trauma, and compassion fatigue is kind of the new name, I think, for vicarious trauma that you might hear around at the moment, compassion fatigue. But I'll use the old terminology of vicarious trauma. So that arises from hearing traumatic stories from our clients. But it's not just a response to one person or one story. Vicarious trauma is the cumulative effect of contact with survivors of trauma. Why does it happen? It happens because we're emotionally involved with our clients, because we care, because we have empathy for them. Some of the risks for developing vicarious trauma we should explore right now, because we need to identify for ourselves when we may be at risk of it. So for workers that have more empathy in their style of practice, they're actually at increased risk of developing vicarious trauma. If you have extra stresses in other areas of your life, and if you have unsustainable professional and work-life boundaries. I love, Jason, that you said this morning, it's not work-life, it's work and life. That kind of hit a chord for me. For example, taking on too much responsibility in your job at work, difficulty leaving work at the end of the day. I think we all know people that are a little like that are very married to the job and want to give it their all. Those workers in particular are more susceptible to being traumatised at work. And finally, lack of personal spirituality, and by that I mean lack of meaning and hope for whatever else is your spiritual basis. If you're not clear on that, and if you don't have a good sense of that, that increases your risk for being traumatised at work. Common signs of vicarious trauma. How do you know if you're running the risk of being traumatised in an ongoing way? Well, if you start feeling difficulty in managing your emotions at work, difficulty making good decisions, and difficulty maintaining your own boundaries. Problems in relationships, either at work or at home, and feeling like you are losing some kind of sense of meaning in your own life, or questioning, your own values. And then it can kind of transition to full-on what we call post-traumatic stress disorders type symptoms, and that is intrusive imagery of stuff from work, or bad things that have happened from work, or bad stories that you've heard, thinking about it at times when you shouldn't be, for example on the weekend or when you're at home. Sleep disturbance, nightmares, anxiety ongoing. So there's some signs that you may be suffering. Protective factors against developing vicarious trauma include having good coping strategies for managing your emotions, having good boundaries, particularly work versus home life, holistic self-care is extremely important. So always being mindful of having time to escape from work, to forget about what's going on there, to rest fully, before going back to work, and to have lots of other activities outside of work, time to play. You need good awareness of your own triggers, and when you're starting to feel triggered or just increase in that arousal, baseline arousal level, know what you can do to ground yourself. Mindfulness, again, is great in helping for this. And if you're not sure of your own spirituality and your view on things, make an effort to create meaning in your own life. All of this stuff sounds very like what we teach our clients, and that's because it's exactly the same stuff. It's one of the good things about working in this business. You're always learning, and you can apply it not just to your work, but to your home life, to your relationships with your own family and friends, with bringing up your kids. So it's all good. Lots of side benefits. Mentioned workplace culture and needing that to as very important in terms of supporting our staff. So workplace culture basically is shared values and beliefs. For any culture, it's shared values and beliefs, shared vocabulary and language that we use, and shared rituals and traditions. We can start though with staff-to-staff interactions. Very important at all times to be trauma-informed in your relationships with your colleagues. So be kind, be friendly, be inclusive, work out any differences at an early stage before it bubbles up out of control. It's important for your own relationships and for your own sense of well-being at work, but it's also important for our clients and our patients who are watching us. As you know, in the work environment, we've got our clients, the people that we serve around us. They are hyper-vigilant to the way that we're behaving and the way that we're behaving towards each other. They pick up on every little nuance. So if you're at the nurse's station and you're complaining about how the night staff didn't do this or that, how annoyed you are, they're going to hear that and they're going to think, well, if she's talking about one of her colleagues like that, what's she saying about me when I'm not around? So very easy to lose that trust and rapport that you've built up with people without even realising that you're doing it. So always be conscious that you're speaking to everybody, not just the clients, in a trauma-informed way. Communication is at the core of all of this. So your verbal communication, your non-verbal communication, as I was talking about before, but also in the written form. So emails, how are we emailing our colleagues? We're busy, often you shoot off emails quickly, everybody's aware of this these days. Read it, make sure you're really happy with what you're saying before you click that send button. And make sure that the language is trauma-informed and that the message is polite and friendly. Voicemail on your messages, and charting as well. So charting in the records around clients. Very careful to use positive, good language if at all possible, because that's there for the record for a long time. Which leads me into vocabulary and language. So respectful, positive, hopeful. We want to avoid terms like patient denies doing this, or refusing to take medications, or non-compliant, all that sort of terminology. Nice to try and reframe it in a more positive way, if possible. Shared rituals and traditions, very important in any culture, very important in our home lives, also important at work. So we like to celebrate our successes at work. At Heartwood Centre, we celebrate birthdays once a month by, one lunchtime bringing in a cake and naming everybody whose birthday it is that month, that kind of thing. We celebrate regular holidays like the Christmas season and Thanksgiving. And at Heartwood, we actually make a big production on those days and have the staff come in and cook a turkey and cook all the meals, only because the clients are not allowed to use the kitchen area. And then we have a great long table right down the hallway, the centre of the client's residence, and all the staff and all the residents currently in the program sit together. We serve each other up. We do all the stuff that everybody does at Thanksgiving and at holiday celebrations. And it's, know, it's only every now and then, but gee, it seems to make a big difference. It's really nice. So I can recommend that sort of thing. We have graduation ceremonies for our residents at Heartwood, for everybody, and no matter how long they've stayed in the program. And just those things really bring everybody together and really give an increased sense of community and build trust building and relationship building. It's all good. So let's summarise how we help support our staff in their trauma-informed practice. So we recognise the importance of staff wellbeing. We convey that the skills and tools we teach our clients are applicable to our staff. We like to be watchful for the effects of vicarious trauma, and we like to explore the ways to mitigate the negative effects of working with trauma survivors. Don't forget, there are many positive aspects to working with trauma victims, lots of job satisfaction, lots of learning throughout. You know, do we ever stop learning at work? I haven't, and I've been doing this for quite a long time now. There's always something that gives you a bit more insight, and there's always ways to think, if I had that time over, next time I'm presented with that problem, I might just try and be a little more mindful of how I react, or be a little more careful in how I speak to somebody. So I might switch gears a bit here and just explore leadership issues. So let's take a look at a definition of leadership, and one that I like is the process by which one or more members of a group influences other group members such that they are motivated to contribute to the achievement of group goals. Now, we have multiple levels of leadership. When we talk about leadership, we all think of our formal leaders. We know who the head of our department is, we know who the head of our discipline is, we know that there's other people over in management side of things. We think of them as our leaders, and we look to them for guidance and support and achieving goals. However, there are informal leaders as well. And if you look back at that definition, it doesn't say that you have to be appointed as a leader, right? In fact, anybody can be a leader, and everybody should be a leader. So you can lead yourself within your interdisciplinary team, you can lead yourself within your own discipline, and you can lead with the other person sitting next to you in your shared office. But if all of us is a leader, that comes with some responsibility. Effective leadership occurs when leaders stand up for the group and its identity, subordinate self-interest and self-identity to promote group interest and group identity. So that means you have to put aside what's going to be good for me in this, what do I think should be best. You have to think what is best for the group, and what are the group's goals that they want to achieve, and how can I help with that? Trauma-informed leadership requires modelling trauma-informed practice at all times. Being available, being present, being attentive and transparent in all interactions. Intentional communication at all times. We need to recognise the value of every team member, everybody that you work with, so that we can build on capacities and strengths. Every individual, and this is clients as well, and we haven't talked about this so much, has identifiable strengths. When we work with somebody and we want to identify strengths, we say, what are your strengths? Nobody knows themselves like themselves. You're your own expert on yourself. So identifying those strengths, articulating those strengths is the basis of moving forward and gives a lot of power to one. Then we can build on those capacities and strengths. Deep democracy is very important in leadership. So a leader is not somebody that stands there and tells everybody else what to do. Leadership is exercising your power through your relationships, not over others. If you do hold a formal leadership position, you need to take time to build relationships with other staff. Just like as practitioners, we need to take time to build relationships with our clients to gain their trust and to learn more about them. But leaders need to do the same thing with their staff. So build relationships, and then that can allow for compassionate and difficult conversations that inevitably have to happen in any work environment. We need to remember to bring compassion to the forefront of all our interactions and processes, and that starts with self-compassion. So what is self-compassion? Self-esteem is your value on your worth as an individual. Self-compassion is about being kind to yourself no matter what, and identifying your strengths and loving yourself, really. So I'd like to review the trauma-informed practice principles that we've kind of brought together through the day today. Firstly, trauma awareness. Secondly, the strong emphasis on safety and trustworthiness. Environmental safety, interpersonal safety, and trusting in relationships. We must always look for the opportunity for choice, collaboration and connection, and our work must always be strengths-based and skills building. So that's helping to build our coping skills for both our clients and for ourselves and with our colleagues. These are some of the words on this final slide that resonate with a trauma-informed workplace. One thing that I noticed that I didn't have on there, and that was humour. As Patty pointed out earlier on this afternoon, humour is terribly important in an environment that is often so stressful and so emotion-charged. A trauma-informed workplace requires consistent trauma-informed leadership with ongoing staff consultation about what works for them. We need to remember ongoing consumer consultation. By consumers, I mean the clients or the patients or the people who access our services. They need to tell us what is a safe environment for them, what that looks like, because we can't always presume to know what they're thinking. We need community consultation, and we need to work with our community partners. So after we've finished today, I'm hoping that you can go back to your workplaces tomorrow or next week and explore what can be done to make your own workplace more trauma-informed. Sometimes, after having a session like this and you feel fired up and you feel like you've got a handle or somewhat of a handle on what trauma-informed means, and that you can go out and look for all these trauma-based responses and practice dealing with them. Sometimes you go back to work and suddenly you see non-trauma-informed practices jumping up in front of you all over the place. You're like, whoa, what's he saying to her? You know, what's that email all about? I don't like what I'm seeing here. And that can be overwhelming. And you're like, wow, how are we going to change this? How are we going to manage that? So I think in response to that, I would say just take it back to yourself. You can only do what you can do, and start looking inwards and recognising your own triggers, your own boundaries. Look after yourself, because if you don't look after yourself, you're going to be one of those people out there kind of losing control every now and then, because we're all going to be extremely challenged from time to time. So bring it back to that, and then you will be modelling good behaviour for your colleagues and for your clients, who will also learn from seeing how you are with your colleagues. And with time and with support from above, with support from the organisations, with support from our formal leaders, gradually our workplaces will become trauma-informed, I'm sure of it. And I think I'd like to finish there. Thank you.